Technology has to have a benefit to the patient, and it has to have a benefit to the practice. We were the first practice in the state of Tennessee to get the Cerec machine. That's the machine that makes the crown, and we can deliver to the patient the crown the same visit. We actually got our first Cerec in 1997. Now this cuts out numerous visits for the patient because the patient doesn't want to be numbed up more than once. So you come in, we numb you up, we prepare the crown, we make the crown, we cement the crown, and you're out the door. If you do it the traditional way, you will come in, you'll be prepared for the crown, they'll take an impression, they'll put a temporary on, the crown will go to the lab. You may or may not lose your temporary while the crown is in the lab, then you come back and the crown is put in. So that could be 2 or 3 visits, and we've done it all in one visit. In today's society, people have a hard time getting off work. So that makes life a lot easier for them to come in one time and the treatment's completed. The other technologies, we actually had one of the first lasers back in 1996. The lasers help us to treat gum disease. It helps us to do biostimulation to help out with sore muscles, TMJ problems, and things like that. We also offer dental implants, and we have the 3-dimensional X-ray machine to help us place implants in the proper position. We even take technology into the hygiene room. We have cavitrons, we have piezos to help the dental hygienist to get the tartar off the teeth easier, make it more comfortable for the patient. It allows for better healing, and it allows for less patient discomfort. Another piece of technology we have that most offices don't have is we have the complete sterilization center. We no longer have an ultrasonic, we have an instrument washer. So now we're not creating aerosols with the ultrasonic, when aerosols are so important in today's society with what we're dealing with. So it's nice to have the instrument washer to take care of our instruments and get them clean and ready for sterilization. When it comes to sedation for the patient with anxiety, we basically have 3 methods. We use nitrous oxide, which is the laughing gas, and it's like having a patient go out and have a couple drinks. I will do IV moderate constant sedation. The patient is still awake, but the patient will have an amnesic effect and they will not remember that they were here. A lot of times we'll take out wisdom teeth and then we'll be waking the patient up or making sure they're comfortable so they can leave, and they go, when are you going to take out my teeth? The third thing that we can do is if the patient needs something deeper, we can call in a dental anesthesiologist to take care of that procedure. We invite you to come and visit Dentistry by Design, and we will give you a tour of the office. We will show you all the technologies that we have that will benefit you, from the laser to the Cerec to the 3-dimensional X-ray to the Cavitron to our sterilization center. Please give Melissa a call.